Good afternoon, everybody. Thank you all so much for attending today. So here we're going to speak with Kelly Hall and Majella Kilkey, and they're talking about their project, Care Across Borders, the role of transnational care arrangements and relationships in ageing migrant lives. And Kelly is a senior lecturer in social policy at the University of Birmingham, and her interests include ageing, social care and migration. And she's done a lot of work on this area, including co-designing and developing a website with the Spanish consulate to look at how to support British people who have migrated to the EU. And she's been working with us on the Sustainable Care Research Programme funded by the ESRC. And Majella Kilkey is Professor of Social Policy at the University of Sheffield, and she is also the co-director of the Migration Research Group in the Faculty of Social Sciences, and she's a co-investigator on the Sustainable Care Programme as well. So I'd like to welcome both our speakers.
Thank you, Kate. Right, so good afternoon, everyone. Thank you very much for coming to the presentation today. The lovely thing about doing this remotely is the opportunity for colleagues all over the world to join us. So I see some familiar names from the Sustainable Care International partners here in the call. So lovely to have you here. So Kelly and I are going to present some work that has emerged from the Sustainable Care Work Package, Care in and Out of Place. So that's a work package within the ESRC funded Sustainable Care Programme that's led by Circle at the University of Sheffield. So it's one work package that was co-led by myself and Louise Ryan. And Kelly Hall, who's speaking today, along with Magda Loring and Aubert Toadzira, were also part of that work package, all contributing to various parts of it. So in particular for the work that I will present, so let's call it the British data, I'd like to acknowledge the fact that that work and the data was collected collaboratively with Louise, Magda and Aubert. So our work within Care in and Out of Place was very much responding to calls for a migration turn within aged care scholarship, policy and practice. So there's a well-established, by now at least, recognition of the migration care intersection regarding the elder care workforce. So we have quite a bit of research now recognizing that our care workforce, particularly when it comes to older people, is increasingly made up of people from other countries, so migrants, migrant care workers. But at least in the UK, and I'd say much of Europe, and that might be quite different, for example, from the situation in North America, but in the UK and much of Europe, there's much less recognition of the salience of migration in the lives of those who require or receive care. So we were interested in our work within Care in and Out of Place to address that lack of recognition or less recognition of migration in the lives of older people themselves, particularly from in respect of care. And our interest was specifically in 4 points of intersection between migration and care. So the first point of intersection is that as a result of historical migration patterns, as well as older people's active role in contemporary migration flows, we have now a much more ethnically diverse older population. The second point of intersection is that because of contemporary international mobility, rising numbers of British older citizens are living outside the UK. And if we combine that first and second point, then what we end up with is family and care networks, which are increasingly dispersed internationally across international geographical, geopolitical borders. At the same time as these processes are ongoing, we have a situation where care experiences for more and more older people are shaped not only by care environment, so the care policy environment, but also by the migration policy environment, which is characterized by hostility and processes of rebordering. So, for example, in the UK context, Brexit most recently, but also a few years before that, changes to the family migration route, which really altered capacity for doing families across borders. But these rebordering processes are also happening at the everyday level. So another example here recently in the UK is the Windrush scandal. We know very little about the scale of these four or three, let's say the first three phenomenon, but even at the most basic level of scale. So in the UK, until we see the new census results, we have very little up-to-date data on older people by ethnicity or by migration status. And what data we do have is very poor quality. It's frequently at the level of broad ethnic categorizations, which mask significant diversity. And for a range of reasons, including the paucity of administrative data and the methodologically nationalist bias of most survey data, we have little knowledge of the scale of cross-border care networks. And the census, which is nationally bounded, the census will not tell us anything further about those cross-border care networks. So in our work, we were kind of operating in this kind of data vacuum quantitatively, unable to say that this is kind of these phenomena are increasingly important, but other processes kind of convinced us that these processes are increasingly prevalent and impacting increasing numbers of people in their day-to-day lives. So in our work package, one of the key empirical focuses was around developing understanding of how older migrants access and experience care. As with the sustainable programme as a whole, our work focused on home care. So it was very much around old people who are aging in place, so aging in the community, staying within their own homes, rather than older people in residential care. So that's a really important point to acknowledge as we move forward with this presentation. So myself, along with Louise Ryan, Magda Loring and Oberto Atzira, we focused fieldwork in England, focused on older people born in the Caribbean, Ireland and Poland, who are now living and growing older in England. We chose those three groups because they are quite invisible in aging research, but also in research around ethnicity and migration status. The Irish and Polish invisible in large part because of their whiteness, and so assumed very much to integrate, to be culturally similar to people born in Britain. The Caribbean, obviously black and highly racialized, minoritized group in the UK, but also very invisible in aging research. And I think that partly reflects the dominant focus on groups such as African Caribbeans on the younger populations, and dominant constructions of younger African Caribbean people in particular as a kind of a social threat. And that's been a dominant theme through recent British history. We know from what data do exist that, for example, the Irish are one of the most aging populations in the UK, but we also suspect that of the Polish, although we have less data, and potentially also the Caribbean population. So those kind of factors informed our choice of those three groups for the UK-based data. I'm going to pass over now to Kelly to explain the second focus within that empirical work in our work package.
Okay, yeah, so the other group of migrants we looked at, or the sort of focus of my research in the Sustainable Care Project, was British people who were born in the UK, retired in the UK, and then moved to Spain. Spain is sort of remains the most prominent, popular retirement destination for British people. And I mean, the data on the number of, I was get asked how many British people live in Spain. There's around 120,000 British people who receive their state pension in Spain. But if you're talking about older British people in Spain, we know the numbers are higher because there's people who don't register in Spain. There's people who aren't yet state pension age but are retired. So it's estimated there's, you know, officially 120,000, up to 1 million if you include those who aren't registered, so a fairly sizable population. There's a growing amount of research on sort of retirement migration to Spain, but that's tended over the last decade or so to focus more on things like the reasons for moving, the kind of social networks, social activities, relationships for those who are more in the kind of third age, who are sort of healthy, who don't yet need care. There's research on health, how people access health services, but very little in the care space. So this research really tries to kind of fill that gap and particularly focus on those who are living in Spain and primarily who have aged in Spain and are now in a situation where they need care. So my emphasis was really on how do British people in Spain sort of access care after maybe they've been living there for sometimes 10 or 20 years even. So Majella, I'll hand back over to you at that point.
So this is the first time that we've brought our data on, let's call them, you know, the British in Spain and older migrants in England together, even though, as we'll see later, we had a common method, common research instruments. We have taken this invitation to present in the Circle seminar series to discuss collectively the data and think about the key points of connection. And so the focus in this presentation is thinking a bit further about that migration turn in aged care scholarship. So this paper doesn't have a very strong policy or practice focus. It's very much thinking kind of conceptually and focused on older people themselves. So when we take on board these points around a migration turn from the perspective of older people, what needs to shift kind of conceptually when we address those issues. So we decided to start with the concept of care convoys. I mean, I think again it's important to note that Kelly and I approach this more from the perspective of migration studies rather than care, but our work in sustainable care has kind of made us engage much more with care. And Kelly, certainly in conversation earlier today, highlighted how much, you know, her work currently is in that space of precisely that intersection between migration and care. So we thought, well, what concept could we as migration researchers work with to help us think about this migration term when it comes to older migrants' experiences. And we arrived through some reading and conversation, we arrived at this concept of care convoys. And what we want to do in this presentation is to have a conversation really with that existing concept of care convoys, have a conversation with, or bring it into conversation with key concepts in migration studies, but particularly those around transnationality and more specifically the concept of transnational ageing. And in this presentation, we're really focused on the contribution that that conversation can make to the concept of care convoys. But as we've been working on these ideas, we actually think that there's lots that care convoys can also contribute to ideas around transnational ageing. So we're going to begin by briefly introducing these conceptual frames, care convoys, transnational ageing, introduce the studies in a bit more detail, and then present some of our key findings through the lens of these conceptual frames. So again, to emphasize, this is very much kind of like the first opportunity Kelly and I have had to present these ideas, so we'd really value your feedback today.
Okay, so just to introduce Convoys of Care, the concept. So the Convoys of Care is based on earlier work by Khan and Antonucci. I think Antonucci is on the call today, which I'm really pleased to see, and hopefully get some really valuable feedback on if we're using or how to use the model. So it's based on the convoy model of social relations, which dates back from sort of 1980 now. This has been developed in relation to care. We've been drawing quite a lot on work by Kemp in 2013 and 2018. And there's a sort of nice definition of convoy of care by Kemp as the evolving collection of individuals who may or may not have close personal connections to the recipient or to one another, but they're people who provide care, and that includes help with daily living, instrumental activities of daily living, socio-emotional care, skilled healthcare, and monitoring and advocacy. So it's that sort of fairly broad notion of care that encompasses, you know, the socio-emotional monitoring and advocacy. And actually this all feeds quite nicely into the definitions around sort of transnational care as well. So Majella's going to sort of talk in a bit more detail about the way in which we're connecting Convoys of Care to sort of the transnational care literature. So it's very much about kind of care relationships, the groups of, or the individuals that support people with their sort of care needs, and we sort of think about this, about how, in which ways these relationships are connected. So the convoy of care is that collection of individuals who support people with their care needs. Part of the emphasis, I suppose just to say, a lot of this literature, the sort of theories based in sort of North America, so it's that kind of perspective for the theory. So the emphasis on sort of care convoys has been around outcomes of care convoys for care recipients and caregivers. And one of the things that care convoys looks at is the intersection of the formal and informal. So we often think about care as separate, as informal and formal care quite separate. The care convoys approach sort of moves beyond that kind of dyadic perspective and thinks about the links between formal and informal care, and this is something we'll come back to a little bit more in the findings. And it also, there's a focus on the dynamics of care convoys over time, and the fact that care convoys and care is not static, and it does very much change. There's also an acknowledgement that you've got the kind of personal factors, the sort of agency, but actually the socio-political contexts that also influence care convoys, and this includes, you know, state policies, resources, at national, local levels, but actually also, I mean, if you're thinking about migrants, very much about sort of transnational levels. I mean, we're going to come on to, you know, some of the sort of structural factors like Brexit, like Windrush, for example, and the impact that they have on migrants and the ability of migrants to access different forms of care, and the sort of shape of their care convoy through their sort of socio-political context within which they're embedded. So just in terms of how we're planning to engage with the care convoys approach. So what I suppose a couple of points that have kind of come out of the care convoys. So first of all, care convoys has rarely been used in community settings. It's tended to be used primarily in sort of assisted living settings. So in our research, we focused very much on older people who were remaining in their own homes, who are based in the community. So that's, I suppose, we differ in that respect. The dominant focus has also been on individual relationships in care convoys, particularly family relationships. And one of the areas that really came out of our data was the really important role of NGOs in supporting older migrants and the care of older migrants. And actually, if you look at, we've kind of looked at the care convoys, and there is a real scarcity like mention of NGOs in care convoys. This is likely to be partly the fact that it doesn't tend to be based in kind of community settings, which is really where you'd find most NGO relationships in supporting care. So we're bringing NGOs into the kind of care convoys approach. Also, if we think about the kind of formal and informal care, and the care convoys approach has thought about the interconnections between the formal and informal, but actually, where is the third sector located? And actually, it's somewhere in the middle. So again, part of our argument as part of the paper will be the NGOs can potentially sit in the kind of boundary of the formal and the informal. In care convoys, the sort of temporal dynamics are emphasised, but the spatial element is largely missing, and it assumes a proximity of care relationships. Again, this is about the nature of care convoys and the context within which research has been undertaken. But actually, if we think about care convoys and migration, actually proximity becomes, and the spatial element becomes really important. Finally, there's been little interrogation of ethnicity and sort of migrant background and diversity in relation to care convoys and care recipients. But actually, it's been acknowledged that, if we go back to the earlier work as well, it's been acknowledged that there's definitely potential to facilitate the understanding of older families across cultures, and this particularly includes transnational families. So Majella's going to just say a little bit more now about connecting care convoys and with transnational ageing.
So yeah, it was really interesting when we read the Fuller et al. Paper, because it was setting out some ideas for innovations in the care convoy concept, and it highlighted transnational families as one potential innovation. And for us working in migration studies, that notion of transnationality is something that is quite well established now, and even in the field of aging, we have a concept of transnational. There is a concept of transnational aging. So Horn and colleagues define this as the organising, shaping, and coping with life in old age in contexts which are no longer limited to the frame of a single nation state. So Horn and colleagues' work builds on the extensive scholarship on transnational families. The classic definition by Bryson and Varela is families that live some or most of the time separated from each other, yet hold together and create something that can be seen as a feeling of collective welfare and unity, namely familyhood, even across national borders. So this recognition that family life can continue and care can continue without proximity, it can happen across borders, was really picked up in the definition of care circulation or transnational care circulation developed by Baldassare and Merlin, their 2014 edited collection, and they define transnational care circulation as the reciprocal, multi-directional and asymmetrical exchange of care that fluctuates over the life course within transnational family networks, subject to the political, economic, cultural and social contexts of both sending and receiving societies. So this notion of transnational ageing really builds on that that earlier work on transnational families and transnational care. But I think within the concept of transnational ageing, there's also a very strong incorporation of ideas from social gerontology, and in particular ideas which emphasize the agency of older people. So older people as active players within their transnational care, transnational family network. So rather than constructing older people simply as recipients, as passive recipients of care, or as people who are left behind in the context of migration, as they're often constructed in migration studies, an emphasis on the agency of older people. So what we've observed in relation to the notion of transnational ageing is that its roots in transnational family and transnational care scholarship means that it emphasizes actual physical cross-border practices. So whether that's people crossing borders themselves through, being mobile, physically mobile, traveling for visits, family reunification, for retirement, or crossing of physical borders virtually, particularly through the use of ICTs for communication. But the emphasis is very much on the actual cross-border practices. But if we go back to the beginnings of transnational scholarship within migration studies, and we look at the pioneering work of Levitt and Glick-Schiller, they distinguish between what they call transnational ways of being. So those are the actual social relations and practices that individuals engage in. So we think that's very much what's captured currently in the transnational ageing work. So those actual practices. They distinguish between those transnational ways of being and what they call transnational ways of belonging. So practices that signal or enact an identity which demonstrates a conscious connection to a particular group. So, for example, the food that you might eat, the newspapers that you might read. In our presentation, we're going to draw on both transnational ways of being and transnational ways of belonging in order to capture two key elements of our ideas around a transnational convoy of care approach. And those are firstly the cross-border care networks and practices, but also something that we feel hasn't been picked up much in the transnational ageing scholarship, which is the socio-ethnic or the ethno-specific practices and relations within the country of residence, much of which is through ethno-specific NGOs and friendships. So we feel that dual focus allows us to capture the intersections that we were interested in relation to migration and ageing from the perspective of older people themselves. So that's firstly the recognition that networks are increasingly dispersed across borders in later life, but also the recognition of the increasing ethnic diversification of ageing populations. So resting on historical migration flows, as we mentioned in the beginning, as well as older people's involvement, to a lesser extent, in contemporary migration and mobility. So in the presentation, we'll draw on both those concepts of transnational ways of being and transnational ways of belonging. So to say something then about the data that we're drawing on here, Even though they were two quite different empirical foci, we designed the studies collectively and with a common set of parameters. So both the data collected in England and that collected in Spain, we had common selection criteria. We were interested in people who were of pensionable age or above. As we've said a couple of times now, people who were still living at home and who were receiving formal or informal care for daily living in their own homes, in their own communities. This emphasis on aging in place. The method of data collection was semi-structured interviews, and to get those going when we were on the ground, we had a demographic questionnaire. So we were kind of collecting information, demographic information, but also we had questions in there about people's well-being, material, subjective, relational well-being, and then a topic guide. And both the demographic questionnaire and the topic guide were common across the two sites. Our field work was done in the same period between 2018 and 2019. And we had two fieldwork sites in England, one in South Yorkshire and one in London. And in total, we had 45 participants across those two sites. And in Spain, Kelly focused her work in the Costa del Sol, a popular destination for British people living in Spain, and Kelly had 33 participants. We also had a common analysis framework, although this is as I said before, this is the first time we've actually brought the data together kind of in a presentation format, but we have had analysis meetings to develop that common framework. In South Yorkshire and London, we also did some supplementary data collection, which wasn't done in Spain, with NGO stakeholders. So we have a few interviews with the NGOs as well. Turning first to the data collected in England, as I said before, our three groups were people from the Caribbean, Ireland and Poland. So these people were all born in Caribbean, Ireland or Poland, but had migrated at some point to live in England. They were mixed, our participants, in terms of marital status. So 22 were still married, 16 were widowed, 5 have been divorced, and 2 were never married. Woman dominated, so 30 of our participants were female, 15 were male. In the English data, the average age was 82. And this is, so our participants are kind of considerably older than, as a collective, than what you find in work done in migration studies on older people, which usually focuses around the point of retirement, so around 60, 65, and usually focuses on the point of retirement as another point of potential decision making in people's migration projects. So big question, will migrants return home at that point of retirement when they're no longer attached to the labour market? So retirement being not only a kind of a key transition point in the life course, but a key transition point in terms of migration projects. So our sample being 60% over the age of 80, average age of 82, is considerably older than much of the research, much of the migration studies research on older migrants. In terms of living situation, 17 were living alone, 23 were living with a spouse, and some of them were also living with a disabled child. 5 had other family members in the household, usually a son or daughter, and not necessarily the case that they were being cared for by the son or daughter. sometimes it was the other way around, that the son or daughter, perhaps because of being disabled, was dependent for care on the older person. So the vast majority of our participants in the English data arrived in England in the post-war period, in the 50s and well, some of them in the 40s actually, in the immediate post-war years. Particularly those from Poland, had arrived in the 40s, 50s and 60s, so 42 of them had come in those years. Some of them, I said, Polish, those early arrivals as a result of kind of resettlement after massive displacement during the Second World War. The Irish and those in the Caribbean coming as part of that post-war labour migration. Two participants came in the 1970s. These were Polish women who came as what we would call in the migration literature married migrants. They came to partner with Polish men who were already here. And one, again, Polish participant came in 2004, an older person who came as part of that enlargement wave of migration from Central and Eastern Europe in 2004 onwards. So in terms of their care situation, across the 45, we had a variety of care. It's spanning, those who needed help with daily living and instrumental activities of daily living, those who had socio-emotional care, receiving skilled health care. Some were, it was about monitoring their care, and others, it was about advocating for their care needs. And there was a real mix as well of the source of care and help being received from those who were paying for services, whether that was kind of state-funded or self-funded, those who were receiving help from spouses or adult children, neighbours, nephew, nieces, and NGOs. And for most, of course, it was a mix, some combination of those. And I've mentioned before, some were also caring for others, caring for spouses or disabled adult children. And for some of those, that was also grandchildren, not necessarily who were co-resident, but on a weekly basis were providing support for grandchildren, and some of whom were disabled. So Kelly now will introduce the Spanish data.
Yeah, so what we're referring to as the Spanish data is basically interviews with 33 older British migrants who are living in the Costa del Sol area of Spain. Actually, the characteristics are relatively similar, so I won't go through all the detail, but very similar to those that Majella introduced. A mix of marital status, more female than male. The average age of mine was 77, 77.6. The range was from 58. I'm going to say a little bit more about the 58-year-old later to explain why we included that person. And again, a sort of mix of living situations. And the average number of years the British had lived in Spain was actually 18. So most have been in Spain for a fairly long time. Some had been there for actually much longer, up to sort of 47 years. Only I think one or two had ever worked in Spain. So they were all sort of retired. Again, mix of care situations, some receiving unpaid care from family or providing care to family, and 18 actually paid for care or the sorts of support in their own home. So I'm just going to present some of our findings. So this is an attempt, sort of Majella's already explained, this is an attempt for us to bring our data together. So we're looking for kind of questions, feedback on how on this. What we're doing is going to split our findings into two sections. The first is on sort of care convoy structure and functions, and the second we're going to sort of present a care convoy typology. So on the first one, which is the care convoy structure and function, what we're going to do here is look at transnational ways of being and transnational ways of belonging. So transnational ways of being, we're going to start with those kind of care relationships that are sort of within and across borders. So I'm going to start with the British in Spain. And I suppose just first of all to think about those family relationships. First of all, as you would probably expect, a spouse was the primary caregiver for all of those that were married, which was just under half of my participants. For those who are married, and particularly those who had been widowed, children, so this is adult children who were primarily in the UK, did play a fairly central role in caregiving. So just an example of the sorts of relationships that some of the migrants had with their children in the UK is Lillian. So one of my participants, she's 80, she's widowed, and she had a really close relationship with her daughter who lived in the UK. So her daughter visited her in Spain, but also Lillian actually returned to the UK every summer when it was really hot in Spain, and she stayed with her daughter for a couple of months every summer. She actually had built an annex to her daughter's home, and that's where she stayed. And actually the annex was there for her in the summer, but actually the annex was also there for if she ever wanted to return. So again, it shows you those kinds of transnational relationships that some of the migrants had with their children in the UK. Also, her daughter, whilst Lillian was in Spain, her daughter actually organised and paid for her to have help in the home, to have certain sort of care and support when she was at home. So her daughter also played a really active role in her care in Spain. So the care she had in Spain was actually a British care service run by British people, which was the most common kind of care arrangement among the participants in my study. She also had an emergency alarm in her home, which was a private service, and again staffed by English-speaking people. And all of this was organised by her daughter. So there were some really strong sort of transnational relationships between parents and children across borders. But actually, I suppose that was probably evident in maybe, well, certainly less than half. A lot of the participants spoke about how their relationships were limited by distance, and they were limited more to socio-economic and financial support. And also a lot of people spoke about the decline they'd had in family relationships post-migration. So they might have retained really strong relationships, particularly with maybe brothers, sisters, other family members. But actually over the years, you know, these are people who'd lived in Spain for a couple of decades. Those relationships had to some extent dwindled. A really interesting situation that I've come across quite a lot over the years is what I refer to as joiners. So this is people who have moved to Spain and left their elderly parents back in the UK. So these are often retirees who've maybe moved to Spain when they're in their 50s or 60s. Their elderly parents then age in the UK and really struggle because they haven't got that support in the UK. So what happens is that person moves to Spain to be with their son, normally a daughter, in Spain. So they join their daughter in Spain and either live independently, or in some cases, in a few cases, actually lived with their daughter in Spain. So these were people in their usually 80s and 90s who moved to Spain at that point because they needed care. So they moved for care, which was a really interesting care situation. So just sort of also wanted to talk a little bit about, in terms of transnational ways of being, around access to the sort of more formal sort of care and support services. So British migrants, older British migrants in Spain generally spoke about quite limited access to welfare services, particularly care services in Spain. So social services care, state care provision in Spain is more limited than in the UK. There was a drive to increase care, publicly funded care in Spain, but then austerity kind of hit and it was pulled back again. So there's a limited amount of access to welfare services, care services in Spain by British people. partly because of availability, but also because of other barriers like language, cultural knowledge and information barriers. People basically didn't know where to go, and they, for example, most British people in Spain can't speak Spanish, or they can speak a few words. They certainly couldn't have a conversation with a social worker, for example, and social workers don't generally speak English. So just a couple of quotes really to sum up some of the difficulties people had in accessing welfare services in Spain. So the first is from Chester, who spoke about, he said, when it's in hospital, you're lovely. So British people, I suppose I'll go back a step and just say that British people, British pensioners can access free healthcare in Spain. That is through reciprocal agreements existing within the EU, and that is actually set to continue despite Brexit. So Chester spoke about he could access hospital care. He said when it's in hospital, you're lovely. But once you're out, once you're back in the community, in your own home, there's nothing. There's no aftercare. There's nothing like that. He said they gave me a piece of paper with all these tablets on, but didn't tell me what they were, what to do with them. And he said, well, what do I do now? So there's very little support in the community from sort of Spanish social services, from Spanish welfare services. Ellen then spoke about her limited information and knowledge of Spanish social care systems. She said, I don't know what the Spanish system is when it comes to care. I suppose we don't apply to their system because we can't speak Spanish. So there is a recognition there that British people don't access the system because of their language barriers. In terms of sort of transnational care, British people, a lot of British people access attendance allowance. This will actually stop from now onwards for any new migrants because of Brexit. So that's actually an important angle, and a lot of people were using their attendance allowance to pay for care in Spain, which they really needed. Some also kind of continue to use the UK NHS. So for example, Lillian, who I mentioned on the previous slide, actually returned to the UK for a shoulder operation. She said she'd rather have it in the UK because she's in a hospital where she can communicate with staff. So there's a lot of transnational care, not only within families, but also if you look at the sort of welfare services as well.
So going back then to migrants in England, despite the fact that those we interviewed, the vast majority of them had spent decades, the majority of their lives living in England, 60, 70 years in England, they still had significant transnational networks. Families were quite dispersed. So this was the case with siblings who were still living either back in the home country or elsewhere because of their own migration. But it was also quite common for those we interviewed for their own children to have migrated, sometimes to the country of birth of their parents, but again also more widely. And that transnational dispersal of family members really helps sustain transnational ways of being. And I look at this in two respects. And the first of that is reciprocal visits. So visiting, so the physical crossing of borders was a key feature of their transnationality. And what I think something that came up that doesn't really come up so much in the transnational care literature, but when we applied the care convoy concept in all its detail, what became apparent analysing the data through that lens was that visits back home were often a self-care, was called in the care convoy literature, a self-care practice, very much emphasising the agency of older migrants in care for themselves. So Samantha is one example, who's originally from Jamaica, and Samantha suffers from arthritis and has limited mobility, but she was recounting the story of her last visit to Jamaica in 2017, and she said, and one morning I got up and I thought, I'm going to leave my stick, and I leave my stick in my bedroom and walk to the dining room, and when my sister and them saw me coming, they started panicking, and they says, where's your stick? And I say, it's in the bedroom. And she says, how do you feel? I says, fine. it's because of the sun. And while I was in the hotel, I didn't bother with the stick so much, but if I was going out, I took my stick because I weren't taking any chances. But it was amazing, you know, but you can see, you know, you're not getting any vitamin D, and just talking about the UK, you're not getting, and there, everything is fresh, the meat, the fish, the fruits. You know, when I go, I eat so much fruits. I eat so much fruits. I just sit down and eat fruits. We went outside the hotel and we bought fruits and we came back and we ate. And, you know, in Samantha's story, there's this real emphasis on how going back to Jamaica is kind of, you know, that self-care, taking care of her own physical well-being as well as other aspects of her well-being. The visits back home were rarely to receive care from other people or other systems. So Eunice, also from the Caribbean, said, you know, you've got your pension to keep you there, but nobody to look after you. And a Polish couple, Jacob and Elvira was talking about her husband, Jacob, becoming ill. And she said, you know, we thought she said they talked about going to live in Poland. But after him becoming ill, and we said, well, the NHS is bad, but there it was worse. It was 100 times worse. It's all private, or you don't know how to use it. He went to hospital, and I didn't like the hospital there. No, definitely not. I didn't know how, and he needs a lot of appliances, things to help him, and his blood there and things. I couldn't get anything in Poland. So it wasn't, you know, going home was certainly not about receiving care from other people, other family members, or from systems. We also found you know, experiences of common experiences of family members visiting from abroad. And that this was very much, in these visits, the socio-emotional support was very much emphasised. We didn't find much evidence of, you know, children coming to provide care or siblings coming to provide and kind of hands-on physical care, but it was very much seen as improving their well-being, emotional well-being, relational well-being, providing that socio-emotional support. Virtual co-presence is a key emphasis in the transnational care literature, and you know, this is certainly a phenomenon in our data amongst our participants. And there was use of new communication platforms, ICTs. So, you know, Samantha again was a prolific user of ICTs, creating what Mariano and Miller call a polymedia environment. So she was scaffolding or layering platforms one on top of another. And so she talked about WhatsApp, you know, it's just sending messages and that, you know, and how you get up and you say good morning, how are you today? And you know how people are in that. And then every now and then you FaceTime to make sure, you know, you can see a face and you know when people's talking to you, how they're feeling. And when she was asked how important FaceTime is to her, Samantha said, well, it is, especially my sister in America. She's my older sister that looks after us, and she's brilliant. So when she's at her daughter's, I will FaceTime her and we chat. So very much an emphasis here in using ICTs for care, not just giving care, but also receiving care from dispersed members of family networks. But I think on the whole in our data, the landline still dominated. People were more likely to use telephones than they were to use ICTs. When they were using ICTs, I think an important observation was that this was often facilitated by other family members, particularly proximate family members, sons-in-law and grandchildren, which points to a particular care function within transnational care convoys, where proximate members help build the digital capital for older migrants so that they can stay in touch with family members. The transnationality, though, in lives, in terms of that transnational well-being of being, is very dynamic across the life course. It's related to individual factors, so the death of family members abroad and their own and others, especially spouses, declining physical mobility and constrained financial resources can also mean that there's less practice, cross-border practice with time. But wider structural factors also mediate this. So Felix, for example, he had poor health, limited mobility. He wanted to spend an extended period of time in Jamaica, where he thought the weather would be great for his health. But his ability to do that was very much constrained by intersecting migration and welfare regimes. He said he'd very much love to have a holiday in Jamaica, be with family and friends who can help me, but I can't. I'm not allowed to be away for more than 3 months. I will lose my disability allowance. I want to have a lot of time with my family, not just go there and spend 3 weeks. That would give my wife a break also, but they do not allow that. And Felix had daughters who lived in Jamaica, and he also spoke about how the migration regime constrained their capacity to come and visit him. He said it's frustrating. I have family there, I'd like to see them often, but they're restricted from visiting me. And it's the system that makes it hard for me to visit Jamaica and for my family to come over and visit.
Okay, so we're going to move now on to transnational ways of belonging. So that's about practices that enact an identity and create connections to particular groups. What we found was that all of our migrants had a sort of strong socio-ethnic connection, which was largely enabled through friendships and particularly NGOs in both Spain and the UK. So in relation to Spain, NGOs, so we're talking here about voluntary organisations, community organisations that have been set up and are run by primarily British people. So they're all English speaking. Some examples are like the British Benevolent Fund, Age Concern España, Aged Care Association. There's a whole host of other kind of community organisations, religious-based organisations in Spain. These tend to operate in the areas where there's large numbers of British people. So in the Costa del Sol, as you might imagine, there's huge numbers of NGO organisations, some more formal than others. So for example, Age Concern España used to receive a lot of support from what was Age Concern at the time, and they're now much more independent organisations that tend to rely on donations and volunteers. So what these organisations do is provide a huge amount of kind of practical help, social support. So they run coffee mornings. They do things like take people to hospital, for a donation if someone can afford it. They take people to the bank. They visit people in hospital. They visit people at home. They hire out equipment. They also do things like help people access and apply for attendance allowance. They help people access the sort of Spanish system. So if they need care, they would help organise an appointment with Spanish social services that do translation. I mean, the list kind of goes on. And actually, these organisations are really central in terms of what we're calling kind of ethno-specific organisations, in terms of having and building a identity. So for the British in Spain, these NGOs really facilitated their British identity and ongoing access to sort of British culture. And obviously that shared language was absolutely fundamental to that. In terms of care, one of the something that actually almost surprised me when I was doing my research is that these organisations also played a really active role in care. Not only did they often support somebody to set up care, so that might be accessing social services, that might be accessing attendance allowance from the UK, that might be accessing a British British private care service in Spain. They also, in some cases, actually paid for care for people in Spain. I'm just going to share a sort of brief example of that. So I'm just going to tell you Max's story. So Max is 58. So he's by far the youngest of my participants. But he was a full-time carer. He was retired. He was a full-time carer for his then 66-year-old wife who had end-stage vascular dementia. So she was terminally ill, and he was, you know, it was very intense care that he was providing. She developed, as you can imagine, considerable care needs, and she was basically confined to a hospital bed in the living room of their small rented home. So their income was a small pension, a very small pension, and also attendance allowance, and a British voluntary organisation had helped them to apply for that. Their relationships with their family in the UK had pretty much disappeared over the years after they moved to Spain, and most of their friendships had been around social activities, which obviously had declined as Max's wife became more poorly. Max had received help from a British friend who'd actually owned the house he was living in, and he was paying a tiny rent, and also they helped with things like shopping and picking up medication. But actually, due to his wife's considerable care needs, he actually reached a point where he just couldn't cope anymore. So what he did was turn to one of the voluntary organisations that not only had supported him to access attendance allowance, what they also did was organise and paid for a live-in care worker. There was no way he could have afforded any care at all, and that voluntary organisation actually stepped in and paid for it. The quote here kind of sums up his situation quite nicely. He said, without people like the voluntary organisation and the care worker they'd organised, can't thank them enough. Without them, his wife wouldn't have had the peacefulness for the end of her life as she had, that he felt he couldn't give her on his own. I mean, he said, if I hadn't had the care, who would have been there anyway? Because he was struggling so much, like bailing out of a boat with a hole in your bucket, getting nowhere fast. So that's just, yeah, an example of the sort of NGOs. And one thing that really came out of my data was the intersection of the formal and informal, and the way in which the NGOs were really important in kind of partly, I would say, filling that space between the formal and the informal. So the NGOs helped people access welfare, and they helped people access welfare from both the UK in terms of things like attendance allowance, and also Spain, so accessing health and care services in Spain and also accessing private care services when needed. Some of my participants refer to volunteers as friends, some even refer to volunteers as family, showing the importance of those relationships to them. And they actually became that central person that they went to if they needed any help at all. What I also found from my data was other sorts of care relationships that again sort of cut across the formal and informal. That were some ways connected to the voluntary, the NGOs, but not always. So there was this idea of people helping each other out, this exchange of care and reciprocal care. So there were examples of, you know, volunteers, first of all, who would just visit people at home in their own time. There was also kind of neighbours, friends helping out. They'd sort of do people shopping, they'd take them to hospital, they'd pick up prescriptions. They'd often do that for a bottle of wine or, you know, a coffee. So there was all this sort of financial and exchange of care in these different spaces that very much cut across the formal and informal space.
So back to the English data and looking at transnational ways of belonging and the role of NGOs specifically, what really stood out from our data, again, despite the fact that most of our participants had spent the vast majority of their lives living in England, they had very strong identities to their country of origin, to their cultures of origin. So, for example, the Polish mostly had Polish passports. They mostly speak Polish in their own homes. They taught their children to speak Polish, and in some cases the grandchildren were learning Polish through Polish Saturday schools. And just a quote here from Josef. He said, I've always been surrounded by Polish people. I don't feel British at all. He was saying, friends of my father, friends of my mother. I joined the Polish Scouts, so again I was involved in the Polish community. Being involved in the Polish community, I got involved in the Polish parish. There I met people. Got involved in the Polish Ex-Combatants Association through the parish. I got involved in the Polish Institute of Catholic Action. So, I've always been involved, surrounded by and involved in the Polish society. And that was common also amongst those who, those of our Irish participants who, mostly had Irish passports, reading Irish newspapers, going to Irish shops. Our Caribbean participants were more diverse in their cultural orientations, and that might reflect the fact that they come from multiple islands. Most asserted their British citizenship, and while they were proud of Caribbean culture, food, music, and identity, they very much emphasised their claim to Britishness. And of course, that might reflect their citizenship status when they arrived, but also perhaps the recent Windrush scandal and a fear that their claims may be undermined. Samantha, whom we introduced earlier, said, well, for a start, I know when I was born, I was British, and she was very much asserting a British, a belonging to Britain, legally at least, if not culturally. And so it's not surprising then that there was a use of ethno-specific NGOs which helped them sustain these transnational ways of belonging kind of on a day-to-day basis, and particularly for their care and well-being. And then, participants spoke of the importance of being able to talk to Caribbeans. Iris, talking about a community service, says, it's really good, we're Caribbeans, we can talk, and sometimes they'll come with a dish that they've cooked or a cake, and it's nice to have them. So that sharing with people from what was considered your own country, your own background, culture. One of the Irish NGOs that we interviewed spoke about the importance of having a place to go that allowed you to be yourself, to have your own culture. He was talking particularly about the Irish language, and so an important space for sharing cultural heritage. And Maeve, who herself was Irish, talked about how much she loved going to her Irish club a couple of days a week, just because you're with your own, we know everyone, you're talking to people that you're familiar with.
So I'm conscious of time, so I just want to, just before I sort of move to the conclusion, just to say, I guess one of the things we have been trying to do is think about the kind of typologies of care convoys. We have we've sort of come across Kemp's work that identified 3 different types of care convoys. Haven't got time to do this, and actually, to be honest, we haven't developed this probably far enough to share. So what I'm going to do is skip now onto the conclusion so that we have time for some questions. So just, I suppose, to try and pull some of this together. So I suppose, first of all, just to re-emphasise the fact that this is our first attempt to pull together these different data sets and to think about it through a kind of care convoy and transnational ageing perspective. So we really welcome some feedback on our ideas and suggestions as to how kind of where we go from here. But just to kind of pull out some of the main sort of discussion and summary points. So first of all, I guess there's that point that we need a cohesive care convoy to age well, and for us it's for our migrants it's partly about aging well in place, and in place is about that kind of migration context. Thinking about kind of kin care relationships, for all of our participants they were important, but actually that issue around proximity was really, really important, and the nature of care relationships was limited by proximity. So for example, emotional advocacy, monitoring, and financial care was possible across borders. But if you're talking about hands-on care, that was much more difficult. So the nature of care was very much limited by proximity. There was this idea that the formal and informal care co-occurred, and voluntary organisations really filled that space in terms of care and support for older migrants. These voluntary organisations were really influential in terms of the kind of what we're talking about as a kind of transnational care convoy, and they sort of in some cases kind of acted at the interplay between the formal and informal by linking migrants into state and private care services. They provided information, language, and access to informal support, those kind of volunteers, friendships, and peer support as well for carers came through really strongly. So the role of the NGOs really came out as quite significant if we're talking about kind of transnational care convoys and their role in that. So I guess just the point to end on is what we're trying to do here is to enrich the concept of care convoys and transnational care. So we're arguing that there's potential to think about transnational care convoys. So it's about contributing transnationalism to the existing body of care convoys literature. But we think there's also potential for the care convoys literature to also enrich the transnational ageing and transnational care literature too. So on that note, unless Majella's got any final points, we'll kind of finish up there and move just to a bit of time for questions.
No, I have nothing to add, Kelly. Thank you.
Thank you both so much.